name is Francesca. I'm the Executive Director of the United Way, and I am the co-chair of the SOS project. That would be me. So what is SOS? Supportive Outreach Services. SOS starts, as all stories do, with a crisis, a bad guy, COVID, a few stubbornly hopeful people, the reluctant heroes, and absolutely no roadmap. It began in the early days of the pandemic when 57 extremely low income, underserved, predominantly substance-using people were locked in this building for 5 weeks. Having been there standing outside the building with public health and Grey County paramedics, we had no idea in 3 years we'd have an award-winning program that would reinvent rural healthcare and social care. All day one was, what do we need to do? What followed wasn't chaos, it was community. Everyone that showed up without policies or processes, but with coffee, compassion, and a determination to figure it all out together. Strong partnerships built on trust, a shared purpose, made this rapid, collaborative process possible. And when the crisis was over, the residents of the building said, please don't leave us. So despite no funding, we kept going, and we built the airplane as we flew it. SOS was named by the people that we serve. All the partners had different names about what we were doing. So we finally said to the clients, if we said meet us at, what would you say? And they said, Supportive Outreach Services. SOS, it stuck, and within weeks, the community understood it. The work of SOS is intentionally complex because the problems it's facing are just as complex. No single agency can meet all these layered needs, and that's not a weakness, that's a strength. SOS wasn't created by one single visionary voice, but a coalition of the willing, as they say. Paramedics, nurses, nurse practitioners, charities, mental health workers, social services, and community leaders, all united by compassion and a simple question of, what if we all just showed up? In a rural community where distance and stigma often keep people from care, we flipped the script. Instead of asking people to come to us, we built a team that would go to them, bringing healthcare, mental health support, and social services right to their doorstep. Because when doors are closed, something else can open. When people throw walls up at us, we find ways around them. And when they entrench those walls, we blow them up, because that's what we do. At its heart, this is a no wrong door approach, where there's actually no door to approach. We've stripped away the usual barriers, the forms, the appointments, the waiting list, the call us back on Monday when we have time. Because when somebody's in crisis and possibly wants to make a change, the last thing they want is a process. We meet people in whatever way they reach out, a walk-up, a text, a quiet introduction from a friend. No expectation, no pressure to commit, just human connection in that moment on their terms. The fire department takes us out on ATVs. We get given gates to keys to conservation areas. We've searched forests with drones gifted to us by the police. For us, harm reduction isn't just a strategy, it's our ethic and our core value. It means reducing all kinds of harms, physical, emotional, and social. Sometimes that means distributing supplies, sometimes it's advocating at the ER, or just sitting with somebody trying to build trust after a trauma. Everyone involved in SOS understands a simple truth. You only feel power when you're not the one with it. That awareness shapes everything, how we listen, how we act, how we show up. We didn't build a new system. We connected the best parts of the one we already have. And when we took it on the road, our communities already have incredible people doing incredible work. Community paramedics who knew the front line of the opioid crisis, staff members at mental health agencies who understood trauma, and charities that just wanted better for those that were coming for their services. What wasn't missing was skill or compassion, it was just an interconnection. So instead of working in our little silos or hiding in our emails, we started showing up together. A medic, a nurse, a social worker, or an addictions counselor, all in one van, all one team. And when a protocol runs up against regulatory restrictions, the team turns to us, the United Way, and says, you don't have to listen to that, do it your way. That's why we're involved. SOS is a beacon, a new way of valuing the most vulnerable in our community. So when SOS calls a partner agency and says, hey, this is SOS, the answer is always, what do you need right now? At its core, SOS reflects a simple but powerful principle. Meet people where they are and stay long enough to connect. Because real change doesn't happen in a single visit. It happens in relationships that hold steady through the hardest moments. SOS represents the best what community care can be. Nimble, human, grounded in trust. At the United Way of Bruce Gray, we believe real change happens when you show up without judgment and stay long enough to connect. It isn't charity, it's justice. So when you're standing on your back porch screaming in rural Canada and rural Grey County, we will hear you, and your neighbor will jump in his tractor, go to his Ford F-150, and drive over, check on you, and give SOS a call. SOS can't fix the system, but it demonstrates what happens when people show up. And sometimes that's where and when the revolution begins.